Hello, everyone. Hello, everyone. It's Dr. David here. I'm getting all set up. We're going to be talking about rotator cuff tears today. Specifically, we're discussing the 10 best exercises to help heal rotator cuff tear so that you can be good for the long term. Just making sure we're all set up on Instagram. There we go. All right, we're live on Instagram, YouTube, and Facebook. I can see your guys' comments if you're on Facebook and on YouTube. I can't if you're on Instagram. Just the limits of our software, no problem. Oh, cool. We have some new members here. We have Bern. Ooh, I'm not going to be able to pronounce that. I can't see it from an angle. But thank you for becoming a member on our YouTube channel. And then we also have this person, Eric Gibb. Fantastic. Thank you, Eric. And I'm not sure the name here. Berm. I'll call you Berman. There we go, Berman. All right, let's get to talking about rotator cuff tears, guys, so that we can get you some help. So I have these exercises pretty much in the order that you would do them depending on how severe you are. So in other words, if you're more severe, if you have a bigger rotator cuff problem, as noted by your pain. Let me make that really distinct and clear here, because it's possible for you to have a rotator cuff tear that's full thickness, really bad as far as the MRI looks, but you actually don't have any pain. That's a big deal. I'll talk more about that as we go through. Like I'll kind of pepper this in, marinate it, or bake it into the video that I'm doing with you guys here, this live stream that we're doing. But what I want to make sure that I drive home before I go into all the details here is that the severity of your tear, according to the MRI, and the severity of your pain, your inability to move your arm, to raise your arm up overhead, they're not the same. You can have a completely torn rotator cuff tear and have no pain, and you can have an intact, perfectly normal looking rotator cuff, but have extreme pain. And then there's all the in-betweens. The list I'm making for you here is to be guided based on your pain, your symptoms, not necessarily the severity of the tear on the MRI. All right, so start with these if you have high pain. Here we go. Here's the first one. Number one is going to be shoulder. Let me erase that. Shoulder rotation. And I'll show you exactly what this looks like, because it's a little simple. It's very simple, but it's also kind of complicated at the same time. So let me get set up for you here. I'm going to be lying down on the table, just like so. You're going to have to find somewhere you can lie down on your back. Bed works perfectly. A couch, if it's big enough for you to spread out. And then the key thing here is you need to get a pillow under your elbow, upper arm, just like this, because what you want to do is not allow your shoulder joint right here to be in a position where this part of your shoulder is kind of protruding forward. This exercise isn't going to work very well when you do that. But if you just put a pillow under your elbow, then it allows this part to kind of sit down back towards the surface you're lying down on, and it puts you in a much better position to do the exercise from. It's possible for you to even put 2 or 3 pillows and have your arm up at this angle and do this exercise. It's going to feel better, especially if you're in more pain. Then after that, once you have a pillow under your arm, you're going to attempt to bring your arm up at this angle so that it's at about 90 degrees right here. What you don't want to do is have it down here or close to that. As long as it doesn't hurt you to come up here. If it does hurt, by the way, you can back off a little bit, find that spot where you're okay. Next step is the exercise itself. Now you're going to rotate your arm this way and this way, and you're trying to produce pure rotation through your upper arm bone. What I see people do often as a mistake is they'll bring their whole arm down like this and then up like this, and they tell them, no, you're doing the 70s disco move where you're putting your finger up and down. You don't want to do that. You want to just produce rotation right here like this. When you do this, you're gently, very gently working your rotator cuff muscles, but that's not the point. The point is to get the ball to settle in the socket, because oftentimes in a rotator cuff tear, the ball moves slightly out of the socket. I wouldn't say it's dislocated. It's just not centered properly in the middle of the socket. And that's what's putting that extra pressure on your rotator cuff tendons and probably producing a tear. So if you just do this easy motion within the amount of motion you can move without any pain, it helps tremendously. So let me say that a little bit different. If you just move up to like right here because you have pain if you go here, just move in the range that you're okay with. You might just move in this zone. Or you might have pain going in this direction. You might just move up here, and that's okay. As you do this exercise, which I usually tell people go for a minute or two on this exercise. If it does hurt you to go into a certain range of pain, very often as you keep going and just work in the pain-free range, it kind of loosens up and you feel like you can go more motion, or maybe even the entire motion that you have available without pain. And it's not a tiring exercise. It's not going to make you sweat. Maybe you'll feel some warmth in your shoulder. But what you're doing is settling the ball in the socket. And oftentimes the reason why people have pain getting into a certain range is because that alignment in the ball and socket joint isn't right. And so it's the motion, the rotation here is limited as a result of that and painful. But as you keep going in the exercise and you keep rotating that ball into the socket the way it's supposed to be, then the alignment improves. And all of a sudden you're like, oh, wow, I can instantly move more. It's magical. Like, you try this at home. Those of you guys that have done this, if you're watching this right now and it's worked for you, just chime in on the chat and say, yep, I did that one to help me out, because it's gold for a lot of people. And it's such a simple exercise. No resistance, no bands, no weight. All you need is a place to lie down and a pillow, and it is magical for you. The way that I would think of this exercise, if you follow our channel for like knee pain, for instance, there's an exercise called tailgate swings where I'm just swinging my legs like this. That's one that's similar to this. It's not 100% accomplishing the same thing, but as far as the point at which you do it in treatment when you're high pain, and the improvements that you can get afterwards are similar. But we're not trying to improve alignment inside the knee joint necessarily. We're trying to circulate fluid. Different process we're trying to accomplish up here in the shoulder. So there you go, shoulder rotations. I do it for a minute or two at a time, as much as needed. And I'll tell people do this frequently, like every hour, every 30 minutes, especially if you're in high pain. The challenge is finding a place to lie down if you're doing this every hour throughout the day. I do teach versions of it seated, but they're not as good as the lying down version. I highly recommend you do the lying down version if you can. All right, guys, let's go to number 2 here next. This one I call an angry cat exercise. So you're gonna have to get on the floor likely for this one. I'm gonna get up on this table we have here. And you got to be careful with the amount of weight you're putting through your arm. But the idea here is you're going to support yourself on your hands like so. You can be on your fists if it hurts your hands. For me, I like my fists better this way. My wrists are straight. If this is the shoulder in question, then what you want to do is offload it. So lean onto the other side. But it's good overall to put some pressure through your arms, through your shoulders, especially in this exercise that we're going to do, because it's going to improve the mechanics, the way the ball and socket move inside the joint, which takes pressure off the rotator cuff tear. And you can make this gentle. It's not an aggressive exercise by just leaning away. But even if you put equal weight between both hands, it's still very gentle. Even though it looks like, oh, you're on your hands and knees, you can put a lot of weight on your legs. As you can see, I'm putting all my weight on my legs, and then maybe 20% of my body weight's going through my hands, and I can even sit back more and lean away, and it's almost nothing going through this arm. Once you start the exercise, here's what you're doing. You're pushing your back up towards the ceiling like an angry cat. That's why the name. Some people will call it a camel exercise, like the hump of a camel. There's a yoga move like this as well. However you want to think about it, the idea is the same there. You're pushing your back up, and when you push your back up like that, what happens in your shoulder blade is you push your shoulder blade forward on your body over your rib cage, and the socket on the shoulder blade, because the socket is part of the shoulder blade where the ball and socket connect for the shoulder, you start pointing that socket forward towards your hand down here. And what happens is, instead of your socket facing outwards and the ball sitting like that, when you lean pressure, the ball wants to go back this way when you lean onto that hand. But when you move that socket this way, now you're forcing the ball to sit into the center of the socket and take pressure off the rotator cuff tendons around it. That's why this one is so good for you. So you're just going to push like that and hold. And I'll tell people hold it for 10 seconds. We're just trying to get the muscles to work right here. You're working at your chest muscles, rotator cuff muscles for sure. And there's versions that I'll show people as well, where I'll tell them, go ahead and push up and then sit back a comfortable amount and then come back up over your hands and then relax. And this one's gold for a lot of people too. And if you have trouble getting on your knees because you have a knee issue, you can do this in standing. It's not quite the same, but you can get a similar effect just like so. And you're pushing up and you're rocking over your hands. Relax, push up. You're still doing that angry cat motion and you're putting some gentle pressure through your shoulder for that ball and socket joint to align better. All right, let me check some comments here, see where you guys are at. Fantastic. We have, we got a super chat. Fantastic. Let me answer your question right now. Does cupping help the shoulder? This is from Jason Seeking 2504. Fantastic question. Cupping might temporarily help the shoulder. It could reduce the pain in the short term. Cupping in and of itself, it's sucking up the tissue, the muscle, the skin, everything under it. And so you can improve blood flow, circulation to that area. However, it's not fixing the root problem. It's not teaching you to move better. It's not making muscle stronger. It's not offloading the joint and better aligning the ball and socket for the mechanics. So it could help in the short term, but in the long term, so that we can get long-term relief. So you're not having a rotator cuff tear bother you the rest of your life and setting up arthritis, maybe a shoulder replacement or a rotator cuff tear surgery one day. I wouldn't rely on cupping to fix a shoulder problem. I would start with it if that's something you're interested in, if you found that it's been helpful for you in the past, but I wouldn't hang out there for the long term expecting it to fix your shoulder. You got to start going through this list that I'm going to give you here today. That's what's going to get you to fix in the long term. And of course, we have a bunch of other videos on YouTube, and we do have a program called the Rotator Cuff Tear Recovery Program, which walks you through this whole process. I'm kind of giving you an overview or a summary of it in this video today, in a summary of the Rotator Cuff Tear Recovery Program. I go into way more detail in that program than I'm going in this video. I'm just touching on some of the highlights that overview the phases of that program here on this video. Good question. Very cool. I just, I didn't even do a mic check with you guys. I assume you guys all hear me. Can you guys just give me like a thumbs up or tell me where you're from? Tell me you can hear me. I'm looking at the comments here. I have Jason saying thank you. You're welcome, Jason. Hey, thank you for your support. You're helping our staff and everybody continue to produce good content like this and help everybody out. Let's see who else we have here. Jason also commented, I sincerely appreciate all you do and post, Dr. David. You're welcome, Jason. I'm happy to help anybody that can be helped, anybody that's willing to listen, because people just go to injections and surgery right away with this stuff. And knowing how to rehab a rotator cuff tear is so confusing. There's so much conflicting information. And, I feel like I add to it sometimes because I'm telling people, don't do this thing that everybody else is doing for your rotator cuff. But, my best advice is try it and see how it works. Like one thing that I tell people all the time is don't do the bands, these banded exercises. Like I just showed you a rotation exercise, the first one, not a good one to do. Let's see. Jason says, hear you well. Fantastic. Thank you, Jason. I appreciate it. Lori says, yes. We have Audrey Brito saying yes. She's over on Facebook. Fantastic. We got some more thumbs up. Mindy gave us 3 thumbs up. Twice Rider is here as well. We got a heart here. Jason gave me a thank you. You're welcome, Jason. Absolutely happy to help. Oh, and then we have Kat Dell from Scotland. Scotland's here. That is so cool. All right, guys, let's keep going on this list and help you guys out. If you do a super chat, I'll try to jump on it really fast, but I might be mid-explanation. I'll get to it first chance I get. All right, what's next here? Hand to heel. Oh, I kind of jumped the gun a little bit on this one, but I'll go in deeper. Hand heel rocking, because there are deeper layers to this. So hand heel rocking is the next level of the angry cat. I was already showing a bit of it. Where the angry cat's really, you're just pushing up like so and holding for 10 seconds. The hand to heel rock is when you're pushing up and then rocking back. But the layer that I would like to highlight to you guys is if you just move your hands away a little bit and you start from this position, this is more like the hand and heel rock. When you sit back, when you bring your hips down to your heels, you're going to be moving your arms kind of up. And if you hurt when you raise your arm, this starts to move you in that direction of being able to safely, pain-free move your arm up overhead without tensioning the rotator cuff, because you're putting your hand against the floor, the bed, the table, wherever you're doing this exercise. You're positioning the ball into the socket and taking tension off the rotator cuff tendons, as long as you're rounding out your back and that with that angry cat motion, and you're allowing your joint to move up, which is critical for healing the rotator cuff tear, for keeping the joint moving well as you move into the next exercises I'm going to show you. So here's how I coach it up. You can, instead of having your hands, closer down here to your legs, move them away. You can go away quite a bit. It just depends on how high you're comfortable with moving. And then you're still pushing your back up. And as you sit back, you have to think about pushing your hands into the table. So as I bring my bottom back all the way, instead of pushing forward this way, I'm now pushing up this way, almost like I'm doing a shrug, which is foreshadowing of what's to come. So pushing forward into the table, and then as I sit back, I'm kind of more shrugging, but also moving forward. I'm still pushing into the table at this angle now. I might hold it here for 5-10 seconds, and then continue to hold it as you return up over your hands to the start position, then relax right there. This is a hand to heel rock. It's the next level after the angry cat. Push up, rock back, doing more of a shrug. I'm literally trying to bring my shoulders up into my ears. Just wanted to emphasize that for you. And then now, instead of bringing my shoulders up into my ears, I'm pushing my shoulder blades forward towards the table, just like that, which leads me to kind of a sub point here. I'm just going to write it down kind of off to the side here. This isn't necessarily an exercise, but it's a concept that you need to know. Rule of the hand. And it's what I'm doing here on this hand to heel rock exercise. So the rule of the hand is so important for rotator cuff tear recovery. And it's not taught by physical therapists, by doctors. To my knowledge, I'm the only person that talks about this, and people that I've trained, that have trained under me, also talk about this, because it makes sense and it fixes pain almost immediately, as long as it's not too severe. But most importantly, it fixes this problem for the long term. Here's what it is. If you think about your hand, wherever your hand goes, your shoulder blade should follow. So if I'm reaching forward, as I was doing on that hand to heel rock, the more forward I reach, my shoulder blade, this entire part of my body right here, should be moving forward like that. Because you have the ability to bring your shoulder blades forward, back, up, to the sides, backwards, like there's all up and down. But wherever your hand goes, if your hand's going forward like this, move the shoulder blade forward. And if your hand goes up, shrug your shoulder blade, move your shoulder blade up. Then if your hand comes towards your body, or you're reaching out to the side kind of behind you, you should be pinching your shoulder blade back. And then think of all the motions in between. So if I'm kind of going forward and up, move the shoulder blade in that direction. When you do this, you're moving that socket for the ball and socket into the right position so that you minimally stress the rotator cuff tendons. If you don't do this, you're putting a lot of tension and stress on the rotator cuff tendons, and you're setting yourself up for a tear. So where this goes wrong, where people don't do this and it sets you up for tears, think of weightlifting, bench pressing in particular, because that's one that causes a lot of shoulder problems for a lot of people, especially you guys out there that are picking up a lot of weight and love to do bench pressing. I don't think there's anything wrong with bench pressing. I think it's fine if you do it, but do it this way, following the rule of the hand. Because what you should be doing is you start with a barbell, right? And you come down, touch your chest, then you're going to push forward. And what you should be doing when you're coming forward is rounding those shoulders forward. What people often get told to do or trained to do through their upbringing, sports in high school, that kind of thing, is they get told, pinch your shoulder blades back, then push the bar forward. And you're not allowed to do that right there. The socket, if you pinch back, is facing sideways. And when that ball and the rest of the arm bone comes forward like that with a bunch of weight, it's pushing into the backside of the joint and tearing your tendons. But if you allow your shoulder to go forward, now you move that socket facing forward, and now the weight is resting into the socket the way it's designed to. You're putting the ball into the socket, so it's bone into the bone. Of course, there's cartilage in there. That's the way the joint's designed to work, not let it rest on tendons and ligaments. So rule of the hand is incredibly important. Same thing happens overhead, by the way. A lot of people reach up overhead with weightlifting exercises. Like if you think of overhead press, military press, thrusters, clean and jerks, those kinds of exercises, any overhead exercise, you should be shrugging, because when you shrug, you move that socket up and now you're stacking the ball onto the socket. But if you're holding your shoulders down, socket's facing sideways, and now you're pushing into the bottom of the joint capsule, which is soft tissue, tendons and ligaments. You need to do the rule of the hand. It needs to be the way you move all the time. So if you're like opening a car door, opening the door to your home, reaching for that thing, you should be subtly moving your shoulder blade forward. If you're reaching up overhead, you should be moving that shoulder blade forward or up proportionally based on the amount of movement that you're doing. So if you're moving halfway up, shrug halfway up. If you're moving all the way up, shrug all the way up. And you should feel those muscles around your shoulder blade working. That's how this is designed to be. So super important. I just want to stop for a moment on the list to cover this, because it's already coming into play with the hand and heel rocking and the angry cat. You're pushing your shoulder blades forward, which creates that angry cat, that camelback motion in your spine. All right, so next one, let's go to number 4. Whew, getting sweaty here, working up a sweat talking to you guys about this because I'm so passionate about it. I just, it's basic mechanics in my mind, the way that you should be moving your shoulders, but it's just not done well in healthcare. And it ends up setting people up for surgery, unnecessary surgery. All right, windshield wipers is the next one. This one's tough. I'm probably going to sweat some more. So you're going to still be on the bed at home. The bed's going to be kind of soft, so you might want to be on the floor. I recommend putting some pillows or something soft under your elbows, because what you're going to do from this position, it's kind of like a plank. You don't have to be on your toes. You can just go onto your knees or even just on your thighs and not do like a full-on plank. But you're doing that camelback angry cat motion from here. It looks like this. You can see I'm already shaking doing this. This is advanced, so you got to be in a little less pain to do this. Once you're holding here, then what you're going to do is move your arms like so. That's why this is called a windshield wiper. So I'm holding my shoulder blades forward as I'm rotating my arms, which holding my shoulder blades forward challenges my muscles that move my shoulder blade so that I can stabilize. Then I'm adding in rotation, which challenges the rotator cuff muscles. So just once again, it's like this, push the back up, and then I'll usually count for 10 reps. That's 1, 2, 3, and so forth. And I'll have people do 5 to 10 rounds of this. So they're doing 50 to 100 reps in total. And this makes you work. This one has to be done when you're in less pain. But I think it's highly effective. Just watch out the elbows. You want to do this on a cushiony surface so that it absorbs some of the rotation for you. If you're on the floor, grab a pillow and do it over the pillow, and that'll be a lot easier on your elbows so you don't cut your elbows open. All right, so that's windshield wipers. Excellent one to be doing. What's next on my list here? Oh yeah, let me move this table out of the way. Let me just get set up here. All right, I hope you guys are benefiting from this so far. I do not have anywhere on this list. In fact, I wrote it down to highlight it to you guys, to avoid doing, where's my stool? Avoid doing banded exercises like with a rubber band and cable pulley exercises, because that's what we're going to cover here next. Let me write it down. Pan back this way, please. Let me change the color. We're going to do pulley assisted arm raises. Sorry for my bad handwriting. But I'll show you this exercise in just a moment, but I just wanted to highlight that. I want you to avoid these types of exercises where you have a rubber band and you're pulling it this way with the rubber band pulling you outwards, or you're going the opposite direction, rubber band's right here, or it might be like a cable attached to a stack of weights, and you're pulling this way, out this way. Sometimes you'll do it from this position as well, where the weight is pulling you this way and you're moving in this direction or this direction. Those exercises are focused on exercising your rotator cuff muscles, which the superficial level of thinking when healing a rotator cuff tear naturally without surgery is that the rotator cuff muscles are weak and you need to strengthen them. But if you think about it, they're torn. How did the tear happen? There's too much pressure going through them. It's actually a muscle imbalance because other muscles aren't doing their job. And it actually comes back to the muscles around the shoulder blade. Because like I've already been saying, if that socket doesn't move around, because you can move your shoulders following the rule of the hand, then you're, by default, if the socket's stable, because you're not allowing it to shrug when you come up or move forward when you reach forward or backwards when you do this motion, then your tendons, your rotator cuff tendons are going to be overstretched. And so it's not a problem of weak rotator cuff tendons. It's a problem of not good motion in your shoulder blade. It's actually called scapular dyskinesia. That would be the medical term. And it's thrown around sometimes, but people don't know what to do with it in the healthcare field. The people will just do rows, like shoulder pinching motions, but they don't think about the rule of the arm, the rule of the hand, like I'm telling you about it. So speaking of the rule of the hand, here's how this works. I've got a pulley set up. And by the way, you can get one of these off Amazon. I got this one off Amazon for maybe $10 to $20, depends on how nice you get and what brand. This one comes with this metal hook because it's designed to go over a door. It's got a little foam pad to not destroy your door. I'm just putting this on our pull-up rack here. There's some other ones that have straps. Those work just fine too. You just want to make sure your door is sturdy and that you're not going to put a ton of pressure. But the idea with this is if you have trouble raising your arm up because it hurts when you get to about there, you can use the rope with that pulley up there that the rope's going through to assist you on the way up. But this is commonly done in physical therapy practices, but I do it different. And here's how. It's the rule of the hand. You need to be applying it here. So whenever you reach up and you get to that point where you're starting to hurt, you need to think, oh, my socket's facing this way. I need to get it to go up. That means you need to shrug. So when you get to about face level with your hand, when my hand's about face level right here, eye level more or less, I tell people, that's your cue to start shrugging your shoulder up. Raise that shoulder up towards your ear and then hold the shrug as you continue to come up overhead. And oftentimes people say, wow, automatically I have like way more motion. I couldn't get this high before. I was only able to get to here. Then I shrugged and all of a sudden I can get to here. Well, yeah, because mechanically you move the socket up and you took tension off the rotator cuff. That's how that works. Now you just have to practice doing it. So that's why the pulley here. What you're going to do for exercise, if this is your limitation, you can't reach up overhead very well, is get to here, shrug, reach up all the way without increasing pain, then hold the shrug. The tendency is to let go of the shrug on the way down, but you want to hold the shrug until you come back down to eye level, right here, then let it go. And then you're practicing this motion of holding the shrug in the upper half of the reach up overhead so that you train your shoulder blade to shrug up and start following the rule of the hand. And eventually you need less and less assistance from your other hand so that you can begin to do it without the pulley. But this is gold for you if you're starting out. And just to give you the side note, if you had a rotator cuff repair surgery, like they went in, they cut you open, they did a repair on your rotator cuff, you'll often start with this, and they will graduate you into those rubber band rotational exercises like I was telling you not to do. But it's appropriate for that person because they had the rotator cuff tear, they had the rotator cuff repaired, and you do have weak rotator cuff muscles in that situation. So you do need to do them, and you do need to start with this. But if we're looking at recovering from a tear non-surgically, which I hope that's what you guys are here for, then we use this different, like how I'm telling you to use it, and don't worry about those rubber bands. All right, hope that helps. Let's go to the chat here, see. Where y'all from? I saw someone was from Scotland. Is there anybody here from Texas? I'm in Texas, or anywhere in the U.S. Can you just chime in here and say where you guys are from? I'd love to see. I see Brenda Brown says, this one with the pulley has been the most benefit to me. It has been my goal. Yeah, it's so beneficial. Absolutely. We got Cliff from Arizona. Brenda Brown's in Vancouver, British Columbia. Fantastic. Silva's, I can't pronounce that, is in Mexico. Awesome. Right over the border where I can see Mexico from my office, actually. We have you. I know you, Miss Yukam, from Buffalo, New York. Fantastic. Francis is in Cincinnati, Ohio. Jason is in Virginia. Fantastic. And we have Kodak Bodine from Lake Charles, Louisiana. Awesome. Grandma is in Ontario. Let's do a couple more. Lori Wilson. Hey, Lori, I see you here all the time too. Is in Dayton, Ohio. Fantastic. All over the U.S. Mindy Gross. I remember you, Mindy, in Fort Lauderdale, down in Florida. And then we got Kansas in the house. Awesome. Indiana's here too. Jennifer from Indiana. All right. Good stuff. Thank you guys for letting me know where you're from. It's always nice to see. All right. Who's next here? What's next on our list? We did the pulleys. All right, we got the wall shrug here next. Here's how this one works. It's the next level from the pulley. You need a wall. Hopefully you have a wall somewhere nearby. I'm going to use this wall right here. And the way that I do this is I like to just take a little half step away from the wall, just so that I'm not too close to the wall or too far away from the wall, because you don't want to lean on the wall or lean away from the wall. What you're going to do is bring your arms to the wall. Is this angle better if I'm over here, or is this in the way? You tell me. Or here. Over here. All right. I figured if you see the side of you, that might be a little bit better. Well, we might demonstrate both if you guys need it. I'm just resting my arms on the wall. And as soon as you rest your arms on the wall, that just takes a little pressure off the rotator cuff. Then what you're thinking about is your arms should be at about 90 degrees right here, and then 90 degrees at the elbow. And then my forearms, I'm trying to keep my forearms parallel. The tendency is to move them like this, but you want to have your forearms parallel on the wall. Then that's the setup. Let me cover the neck, because the neck is super important in this exercise. What a lot of people want to do with their neck is have their chin out forward like this, and they're kind of looking up, and the neck's out like this, is forward head posture. I'm exaggerating, but most of the time they have a little bit of this going on. And what I cue people to do is to make a baby double chin. So if you think of a double chin, but make a baby one like that. That's a full-on double chin. That's a baby double chin. Another way of saying this is 100% double chin, like where you're going as hard as you can. When you do a double chin, a 100% double chin, you should feel some muscles behind your throat, but on the front of your neck, tighten up and start to work. Those muscles are your deep neck flexors, and they're very important to have working a little bit when doing this wall shrug exercise. I don't want you to go 100%. I just want you to go 10, 20%. So do the baby double chin just like this, and as soon as you feel them starting to turn on, you're probably there. All right, so arms parallel, 90-90, feet are set right, baby double chin. Now the trick is because you're going to do shrug, when you shrug, your double chin's going to want to go away. You're going to lose it. You have to fight to keep it, and so you might have to be a little more intense with your double chin. So I'm going to shrug up, and yeah, my double chin's having to work just a little extra harder, those deep neck flexor muscles. And then hold it here for 10 seconds. After 10 seconds, relax, and then repeat. Shrug up, hold for 10 seconds, keep the double chin going, a little bit of a baby double chin. And what you should feel as you're holding the shoulders shrugged is these muscles right here. They come up to the base of your skull, all on the side of your neck, kind of on the back side, and they go out to the corner of your shoulder. It's called the upper trap muscle, and you have them on both sides. And what I challenge you to do if you're doing this exercise, this is a very valuable exercise, by the way. What I challenge you to do is go up all the way. I often will come behind somebody, I'll pretend somebody's doing it right there, and I'll stand right here and I'll put my hands on the side of their body and I'll come down and I'll push their shoulder blades all the way up, because very often they start this exercise and they're going like that. They shrug that much. And then once I push your shoulder blades up, they go, whoa, I didn't know I could go up that high. And you could see I'm going 100% here. I don't know if you could tell, but I'm shaking a bit. And that's when I lift weights. I work on my upper traps. This is effort at the top of the motion. I'm going as high as I possibly can. I'm starting to sweat a little bit even. So it should be kind of an intense exercise. You should feel like it's work. Like I got warm and I just did a few reps here. I like people to do 10 reps multiple times a day. As you get better at this exercise, I like people to knock out 100 reps in a day, maybe not all at once, but spread out, because it builds into the next exercise. And this right here, the reason why it's so important is because it's setting you up to be able to do the rule of the hand in life. Whenever you go scratch your head, whenever you go wash your hair, when you reach for that top cabinet, you should be shrugging a little bit and have the strength to do it, have the ability to do it without thinking, where it's even just habit for you because you're practicing this so much, but you need the strength to back up the habit. Because if the strength's not there, then your body's just going to default to moving through the easiest way it possibly can, never mind moving properly using the right muscles. That's where you end up in an imbalance. And if that upper trap isn't doing its job to shrug your shoulder up, then what happens is your rotator cuff muscle starts to take over and say, well, we're just going to raise that arm as much as it'll go, even though the socket's kind of limiting the motion here, at the expense of the tendons. That's why you end up with that rotator cuff tear, the tendon. All right, so I can't stress how important that exercise is for you guys if you haven't done it yet. Who else we have here? Orion Zay is from Madrid in Spain. Fantastic. Grand Prairie, Texas. Hey, Steve, fellow Texan. We have some questions here. I'll get to the questions before we're done here today. Fantastic. LA Cali, awesome. A few more people jumping in here. And then Jason is telling Mindy that he's jealous over something. All right, let's go into the next one here. Where are we at? Number 7 is your overhead reach. So once you've gone through all this stuff, this is mainly to calm your shoulder pain down. The numbers in black here, 1 through 4. The blue is to teach you to move through the rule of hand better, because we're starting to shrug here. Here we're really challenging the shrug. In an overhead reach, it's like we're doing the wall shrug, but now without the wall. So just to show you what this looks like, I'm going to stand right here. It's the graduation from the wall. So instead of, on the wall, you'd be like this, shrugging. Now you're going to reach up overhead all the way and then shrug your shoulders here. You're going up as high as you can. For me, you can see I'm not perfectly straight up. I have stiff shoulders. This is my genetic limitation. I can't go more unless I arc my back, but you don't want to do that. You want to keep your back safe. So that's my limit right there. You might have more flexibility than me. My poor kids are the same as me. But anyways, right here, if you look at the space between my ears and my shoulders, as best as you can. Everybody's a little bit different based on their genetics, but I find that 8 to 9 out of 10 people can do this. You're bringing your shoulders to touch your ears and hold it. And you can see I'm shrugging. I'm keeping a little bit of a double chin here as well, because the tendency is to do this. The reason why people do this right here is because their deep neck flexors, which help to stabilize the neck, are so weak. Those upper traps, they connect to the base of your skull. And when you contract them, they're yanking the back side of your skull this way. And so your neck just gives up and it goes, ugh. And now you're compressing all those discs in your spine and your neck. You're pinching the nerves. That's what's setting up things like carpal tunnel syndrome and other nerve problems in the arm and hand. That's why some people get numbness and tingling that kind of just comes on at random times. It's because they're doing this all day and they don't have good deep neck flexor strength. And the way that you work your deep neck flexors, which I'm kind of countercultural on this too in the healthcare field, It's not, there's blood pressure cuff exercises. If you know, you know. If you've been through physical therapy, you know the blood pressure cuff exercises. There's like chin retractions that people will do where they force their chin back, and the idea is they're trying to work their deep neck flexors. But the deep neck flexors are designed to stabilize your neck as your arms move. That's why I'm telling you to do this deep neck flexor exercise, the baby double chin, in the wall shrug, and then eventually this overhead reach. Now, if you practice this overhead reach while keeping your chin tucked, you're working out your deep neck flexors and the upper trap muscles. And most importantly, the reason why we're here, you're saving your rotator cuff. You're allowing it to heal so that you can avoid surgery, and you're teaching your shoulder to move properly so that you're not running into rotator cuff tear problems later on, so you don't have continued shoulder pain. Hope that makes sense to you guys. If it doesn't, please ask questions because I want to answer them before we're done today. All right, next up, let's get into some blue here. Number 8. I'm just going to write OH for overhead reach with weights now. So now we're finally weightlifting. Got some little baby weights right here. Some might be heavy for some of you guys, but 5 pounds each. So we practiced the overhead reach. Now you're doing it with weight. Holding. You got to hold it, okay? So start out with small weights. 5 pounds or less is what I would recommend. Even, if you have these, just hold 1 5-pound weight or a 1 or a 2-pound weight by the ends like this. Pick up a water bottle, a couple of water bottles. You don't even have to buy weights. A can, like a can of corn, a can of soup, something like that. Hold it on the ends or have a can in each hand. Come up and shrug. Close that gap as best as you can between your ear and your shoulders. Have somebody come up behind you and push you up if you need to. Maintain your double chin and hold it for 10 seconds. The hold is important. There's a scientific reason. When you hold, there's a nerve signal coming from your brain, from the part of your brain that tells your muscles to move you up like this, that connects to the muscle. It's called the motor unit. And when you send more signals consistently, you increase the amount of cells that are going to activate. So you increase essentially the entire power of the muscle. You wake up the entire muscle. By doing the hold in the beginning of fixing a problem like this, you're setting up the entire muscle to work more efficiently. If you go straight into reps and you haven't been working out a muscle very well, then you're really only utilizing a percentage of the muscle cells because you have to make sure they're all awake. So the holds are very important. Don't go to the big weights yet and don't start doing reps yet. Use a small weight and hold 10 seconds. Scientific reason for the 10 seconds. The science says 9 seconds, so I'm assuming you guys are going to count too fast. You know how kids count? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So I'm hoping you get at least 9 seconds in if you can do a 10-second hold. Ideally, be a grown-up, count for 10 true seconds, use a timer or something like that. I would be doing this one as well, climbing my way up to 50 to 100 reps a day, as you can do this without shoulder pain, without rotator cuff issues. It should feel like it's just challenging, like fatiguing, not necessarily hurtful. It should not hurt your shoulder. If you're trying to do these exercises over here, the green and the blue, and it's hurting you, you need to be in the black section doing these exercises. You're not ready for these other ones just yet. And then you need to start learning the rule of the hand, probably with the pulley assisted one. And of the black ones, windshield wipers could be kind of difficult for you, so I might even stick with the first 3 a bit more. All right, we're on number 9 here. Oh, it's going to get interesting now. We're going to do hanging. You need to pull a bar from this for this one. Pull up bar. That's why I have ours here. And I'll demonstrate what this does. Let me show you on the shoulder model real quick before we move over there. So you can see the ball right there, sockets in there. Just to show you what I was talking about. If the shoulder blade can move, right? So rule the hand. When you reach forward, shoulder blade can do this. That socket is facing outwards. If your arm, if your hand is going forward or up, can you see how you're just going to sink that ball out of the socket? Or if the shoulder blade isn't coming forward like this, you're going to move it into the back of the socket. But if you move your shoulder blade forward, when you're reaching forward, then you align it better. If you move that shoulder blade up, then you align it better there. You settle the ball into the socket. Very important for the roll of the hand. Now, talking about hanging, I'm going to be reaching up, and now we're actually pulling apart instead of compressing. But the reason why this is so important is because this structure right here, this is called the acromion. It's the corner of your shoulder. And then we have a ligament that attaches to this bone that protrudes in the front of the shoulder blade. This arch structure right here, it makes an arch over the ball and socket area. It can start to cave down. We have research that shows that this can cave down. It can get a little pokey on the inside there. There's surgeons that go in there and clean it up, open it up for you as part of a surgery to help with shoulder pain, arthritis, that kind of thing. But I strongly believe, and there's some books written about this. There's some doctors. I've interviewed a doctor about this, a shoulder doctor named Dr. Kirsch, and I love his theory. I think it matters a whole lot. When you consistently practice bringing your arm up into that space, as long as it's not super painful, and then you hang from there, you're molding your body essentially. You're molding this part of your shoulder to maintain its ability to get there. It's a good thing for your shoulder, your rotator cuff, to tolerate this. Now, before you're thinking like, holy cow, he wants me to hang. I weigh as much as a house. I haven't hang. My hands are weak. I have shoulder. You're only doing a percentage of your body weight. I'll show you what I mean. Let's go over to the rack so I can describe exactly what I mean here. All right, so this pull-up bar, I'm tall. I'm 6'2". This pull-up bar doesn't go up high enough for me. But the idea is if you're starting out on this, you're going to want to do this in a place where your feet still touch the ground. So can you see my feet on the video here? I'm standing here. I'm not dangling all the way. So if you come back up to my hands now, when I dangle right here, I'm not giving it my whole weight. I'm maybe at 50% here. If you see my feet there, they're touching the ground. So at home, if you get a pull-up bar, you can get one of those that install in your door frame. Just make sure your door frame's sturdy enough to handle it. And you can put a step stool, if you can't reach the ground, something that you can touch the ground on, a chair or something sturdy that you know isn't going to slip under you. And you could just put 10% of your body weight, 20, 30, 50, figure out the amount that you can tolerate and then hang out here for 10 seconds at a time. 5 seconds if that's all you can do. Work your way up to doing 30 seconds or a minute eventually. And part of what has to happen is your strength, your grip strength in your hands has to improve as well, which, you know what? We have pretty good research that shows that your grip strength correlates with your rotator cuff strength. So that's another reason why this is so important. If you maintain your ability to grip well in your hand, which is going to be challenged by this, you're actually likely going to make your rotator cuff stronger without doing these silly rubber band exercises, cable weight exercises like this, and without putting bad tension on your rotator cuff. Because one of the things that you need to know about the rotator cuff tendons and the muscles is that they're named inappropriately, in my opinion. They're named rotator cuff muscles because the thought is that they help with rotation. And they do indirectly, but their primary motion, if you look at this model is great because it shows all the rotator cuff muscles. All this red stuff, those are the rotator cuff muscles, and then this white stuff right here is the tendons from the muscles that connected to the bone. The main function of rotator cuff muscles is to suck the ball into the socket and stabilize the ball on the socket, because the socket itself is tiny compared to see the bone in there? It's a tiny little bone. Compared to the socket of the hip, it's huge compared to this. And so it's kind of like putting a little tiny plate. I don't know what, like if you think of like a teacup plate on a basketball. That's the proportion here. So you need a lot of extra stuff to hold the basketball onto the teacup plate. Whereas the hip joint, it's a big socket, a deep socket for the ball. It engulfs half of it or more. Here in the shoulder, it's not that congruent. It doesn't engulf it as much, but that's intentional so that you can have more mobility in your shoulder than you do in your hip. You're also not walking on your hands normally anyway. You're walking on your hips all the time, on your legs, which goes through your hips. So you need that extra mobility So the rotator cuff muscles and their tendons are designed to hold the ball into the socket. This hanging exercise, I think, is golden for you. Once you've gotten to the point where you're feeling great, your shoulders are healthy, and you want to maintain good health in your shoulders, you should be hanging on a consistent basis. I would do this every day for a minute or two at a time. If you can get up to that, that's excellent. If you can exercise while hanging, for instance, I'll do toes to bar where I'm kicking my feet up towards the bar. I'm working on my abs doing that. I'll do pull-ups as well. So I'm doing some version of a hanging exercise when I have my gym time. But if that's not your thing, that's fine. I would just get a pull-up station like this, get a pull-up bar that goes in your doorway, or there's something you can install on the studs of your walls at home if that's something that you like to do in the garage or something like that. And I would go to that pull-up bar and dangle for a minute or two. Doesn't have to be your full body weight. Do what you can. I would like you to work up to your body weight, though. I think that'd be healthiest long-term to make sure that all the structures in your shoulder joint are normalized. And even if you have a big tear, you can do this, the light version, like where you're only hanging by 10% of your body weight or some percentage of your body weight. All right, that covers hanging. We're almost at 10. Let's cover it here next. We got thrusters. Sorry, I'm dragging my pen, not lifting it enough. A thruster exercise. I love this exercise. One of my favorite to do. If you've been watching us for a while, you've probably seen me do this in the gym. We used to do those lives earlier this year. And I'm going to show you two versions of it, one with the dumbbells and one with the barbell. Hopefully we can fit the barbell in here. But it is an overhead press with weights, but I also include a squat. So it's a bit of a jump here. I would start with this exercise where you're picking up the weights, where you're doing reps. Now, finally, I'm getting to reps. Think about that for a second. So many people with rotator cuff tears are going straight into weightlifting exercises where they're doing reps rather than holds. I waited till number 10 here because all the stuff we worked on before was calming the pain down, getting the ball to settle in the socket properly, teaching proper shoulder mechanics. All that needs to happen so that you can do the reps properly. Because now when we're going to be doing an overhead press, I'm assuming you know the rule of the hand and you have enough strength in your upper traps to be able to pick it up overhead, and it shouldn't hurt. You should have been done with pain a while ago. Now you're just thinking, how can I optimize my shoulder health so I'm not having another shoulder problem again here next month or next year? So when you're picking up overhead, here's how it works. You should be right about here, like we did with the pulley, shrugging. And then when you get up overhead, shrug all the way for a moment because it's full on extension. You're picking up your hands all the way, and then hold the shrug until you get back down to about eye height, and then bring down the shoulders, relax the shoulders. So in real time, an overhead press looks like this. You kind of can't tell, but you feel it. When you're doing this overhead press and you're shrugging, you feel these shrug muscles work more than anything else. I haven't even gone to the thruster yet. Let me get to that. But before I do, I want to tell you an exercise that you should absolutely avoid, especially if you have a rotator cuff tear, but I think it's good to avoid all around, even if you don't have a rotator cuff tear. And it's this lateral raise exercise and front raises, any sort of raise like this where you're not focused on moving your shoulder blade, because this exercise doesn't follow the rule of the hand, right? The goal is to just lift your arms up. And people will say, I'm working out my deltoids. And yeah, you are, but you're also straining your rotator cuff muscles. The only time that I've ever told somebody, go ahead and do this exercise, is I had a bodybuilder come in and their goal is to chisel certain muscles in their deltoids because it mattered for the flex, for the competition. I said, that's the only time that I could think it's appropriate to do, but I'd warn them of rule of the hand and give them all the whole story. But if you're a person that's like, I just want to heal my shoulder, I don't care about bodybuilding, then just avoid this altogether. And it's tough because you have physical therapists telling you to do this, you have fitness trainers telling you to do this. But if you think of the mechanics of it, it's not teaching you to move your shoulder blade properly in all the directions that it should be going in. Therefore, it's working against you. It's forcing your rotator cuff tendons to take on more pressure than they're designed to. And if you keep training this way, as the weights get heavier and you do more reps, as the workouts get more intense, you're asking for something to tear later on. I would avoid it. You're better off doing overhead presses with significant weight. I'll pull out the barbell here in a second, but make sure that as you're pressing up, you're shrugging. That's the way your body's designed to work. We're bipedal beings. In other words, we're on 2 feet. So we're designed to be able to hold weight up like this overhead, but you have to stack it, and shrugging like that makes you stack the arm bone, the ball of the arm bone onto the socket of the shoulder blade. That's the way we're supposed to work. That's a proper movement right there. So thruster, sorry, I haven't even gone to that. If you can show my legs a bit. You're doing a squat, and then when you come up, you're adding the overhead press to it. You have to have already mastered rule of the hand. You have to know to shrug as you come up. All right, with the barbell, thank you. Same concept. Coming down, I like to squat down low, bring my elbows to my knees. It's okay if you can't. And then when you're coming up, you're using momentum to get the bar overhead. And I like this one because if you go faster, as you get momentum coming up, when you're using your glutes right here to pop the weight up, you're saving your rotator cuff, in my opinion, because that momentum, as your arm's coming through about this range of motion right here, that's when you're most likely to use your rotator cuff muscles to produce the force to go up. But if you use the momentum from your legs to get it to come up, then you're cheating, if you will. But biomechanically, as I think of it, for healing a rotator cuff tear, that's a good cheat to take. That's a good shortcut to take, because then when you get to the top of the motion, you're forcing your rotator, your shrug muscles, your upper traps to now work, and you saved your rotator cuff. So all day, I'll take this cheat where you're not, going real slow through the motion. That's going to tension your rotator cuff. But using some momentum to get up. You might do a thruster like this. If you're able to, you can go down lower and do that same motion. All right, guys, that covers all 10 exercises. So let me just review real quick what you'll be doing if you're going to take yourself through these steps to heal a rotator cuff tear for the long term. So I would start with these 4 if you're dealing with high pain. Remember, we talked about it doesn't matter the tear as much as it matters the pain level, because you might have no tear but high pain. Then you want to start with these for sure. But you might have a tear that happened a while ago and you're kind of recovering from the pain. Then you might go into this section and this section. And as you get more advanced and you're able to tolerate even more, you have no pain. You're just now making sure that you're healthy. Then you want to get into these last 3 right here. All right, I hope that is beneficial for y'all. Let me get wiped off here because I am dripping in sweat now. I get so hot, like incredibly hot, easy. I like my living space to be cold. It's usually too cold for other people. All my office my office staff, they get super cold and they come in summer right now, or I guess at the tail end of summer. But even in the peak of summer, they have sweaters in the office, and I'm very comfortable in my short sleeve, or I'll even have a tank top on sometimes. All right, so let's get into some questions here. Michael's saying, doing a great job. Thank you. Let's go to the beginning here. We got Vango Betsy. I've done all of them, too painful, have had 2 injections. Now what? I'm sorry to hear that, Vango. This one's pretty easy. The shoulder rotation is usually not painful. If it's painful for you, you're probably rotating too much. You might not have the pillow set up properly. You need to have maybe even 2 or 3 pillows under your arm. But that one I can usually figure out for people very, very well, so they can do it without pain. And then the pulley exercise, the pulley assisted one, is one to jump to pretty quick after you're getting some traction with all these exercises. And that often is not that painful as well. Now, you could even do the pulley in this section up here if you're not going too high. You can even just shrug to here. And oftentimes we can start to do the pulley early before we get to the full range of overhead motion. So I'd encourage you to give it a shot before you end up having surgery. Now, that being said, there are cases sometimes where if there's a lot of arthritis, osteoarthritis in the shoulder joint, this may not work for you. Even though you have a rotator cuff tear, the arthritis might be bad enough that it's not letting your shoulder joint move properly. And so you do need to have a surgery in those cases. It just depends on your specific situation. That being said, I'm not saying that everyone with a rotator cuff tear and osteoarthritis should be getting surgery, because a lot of those people do just fine. Even though they have some osteoarthritis in their shoulder and a rotator cuff tear, they can still go through all this and reach up overhead with weights and feel fantastic for the long term. It's just a matter of going through the process. It's very much a process. There's no magic exercise. Notice I've never said, just do this one, you're going to be fine, or just do this purple section, you're going to be fine. You have to kind of march through all of these, and it may take you months, at the minimum weeks, to get through all this stuff for you to get to the point where you're saying, I feel fantastic in my shoulder, and I think I know how to do good movement through the rest of my life for the long term. Hope that helps you out there. All right, who's next here? We got Jason. We already helped out Jason. Rosanna Burgess says, Dr. David, how long does it take for rotator cuff to heal? Thank you. Good question, Rosanna. It varies tremendously because, like I said, you might not get a full healing as far as what the MRI shows. So what I tell people all the time is go off your symptoms, because if you're hurting less, you're able to move better. That's progress. You might have an MRI today and they show all this bad stuff on your rotator cuff in your MRI, but you feel better after a couple of months, 2-3 months. And if you were to have another MRI, it might look the same. You might still have that tear there, but it healed, it's scarred down, and maybe didn't reconnect. In some cases it does reconnect, but maybe it didn't reconnect, but you're moving better and you're setting yourself up to be able to do that the rest of your life if you're going through this process that I've outlined here. So it could be anywhere from a couple of months to possibly 6 months or longer. If you have osteoarthritis, it might take you a lot longer. It also, I think the biggest factor, I'll say this, Rosanna, the biggest factor that's going to determine how long it takes you to recover from a rotator cuff tear is how bad your muscle imbalance is, how weak your upper traps are, and your other shoulder blade muscles that help you move properly to do the rule of the hand. That's really what it is. Because as soon as you get this going and you calm down the initial pain, then this is where people get stuck oftentimes. Getting the shrug to happen correctly, getting the forward shoulder blade motion and the backward shoulder blade motion to happen in the right timing. Because it's not just a matter of strength, but it's also timing. You have to think of the two. You need enough strength to be able to do it on command, but then once you have the strength, you have to practice doing it when you're opening the door at your house, or when you're reaching up in the bathroom for the top cabinet. You have to practice the motion as well. So it matters with that. You can't, and that has to be done, by the way. Because if you go back to life as usual, if you go through rehab, this is why physical therapy often doesn't work. I did the exercises, I did the bands, I did the weights, I did everything the doctor wanted me to do, I did everything the PT wanted me to do, but you're not changing the way you move at home. You still pick up stuff and your shoulders sunken down and you're tensioning your rotator cuff again. Yeah, you're going to have a rotator cuff problem again later on, or some other issue, shoulder arthritis or a labral tear in your shoulder. Things are going to continue to get injured because you haven't fixed the mechanics. That's what I'm into. That's what I'm showing you here. Hope that helps, Rosanna. All right, Janet Butler says, I fell down a flight of stairs and hurt both shoulders. Sorry, Janet. It has only just started to feel better after 3 months. I will try these exercises. Thanks. You're welcome, Janet. That's tough. That will definitely set you back a little while. I hope that you recover super fast. These exercises should absolutely help you get the mechanics going again so that you're feeling good enough to do whatever you want to do. The falls are no fun, especially downstairs. Best of luck to you, Janet. Brendan Connolly, 1914 says, chondromalacia in both knees. Doc says the kneecaps are not tracking right, causing issues. My question is, once I get glutes, awesome, abs and foot muscles strong, will the kneecap begin tracking correctly? Absolutely yes. I don't have a knee model on me today. I have the skeleton. Let me pull the skeleton over and show you what I mean here. So when the doctor says the kneecaps aren't tracking correctly, they're on the right track as far as the thinking goes, as far as thinking about how the body works. But the way that most healthcare professionals will try to get your kneecaps to track properly is by strengthening the quads for some reason, or which just pulls the kneecap harder against your the femur, the thigh bone. And then surgically, they'll loosen the ligaments on one side of the knee, out on the outside of the kneecap, usually to allow the kneecap to float inwards some. But that's not a good long-term solution either, because what you should be fixing is the position of your thigh bone. Everybody looks at the position of the kneecap, but nobody thinks about the position of the thigh bone. And that's what we're addressing by strengthening the glutes and the feet. And then strengthening your abs just gives your glutes a better base to work from, a better foundation to work from. I just took the thigh bone off, the whole leg off here. There we go. So there's the kneecap, there's the foot down there, and there's the hip at the top. So they're saying that your knee is probably shifted inwards this way. But think about it, if your kneecap's floating in tendon, and it rests on the thigh bone in that groove right in there. But if you can rotate your thigh bone, can you see how that can shift the position of the kneecap relative to the thigh bone? And it moves it kind of inwards relatively. Well, when you rotate your thigh bone outwards, you correct the problem, and that's what glutes will do for you. If you strengthen your glutes, it wants to rotate your thigh bone out subtly. It helps with the alignment down here. Then with the foot muscles, if you have a dropped arch, it's going to shift your knee this way inwards and push your kneecap kind of relatively outwards. But if you raise your arch, it shifts everything outwards this way, which moves the knee outwards too, which if your kneecap's floating, it'll move the thigh bone under it. So it's all about moving the thigh bone rather than moving the kneecap. But medical people, they tend to think, how do we move the kneecap? To the point where they'll even do surgery to surgically move your kneecap. And that's appropriate in rare cases of genetic anomalies. But for the mass population that's dealing with condylomalacia patellofemoral pain syndrome, and then even like osteoarthritis behind the kneecap, it's this fix that I'm telling you. And you're on the right track, strengthening your glutes, your abs, and your feet. That's where we need to go. Good job. All right, let's look at the next comments here. We have Jason here again, 53-year-old weightlifter, can't stop the heavy lifting, started to use your therapy, absolutely must. Yeah, you got to be careful. If you're having pain in your shoulder or anywhere else in your body and you're pursuing weightlifting still, there's something mechanically wrong. You have to back off on the amount of weight that you're doing. And it might even be that you need to do body weight or even unweight the exercises. There's ways to do that so that you can do the movements properly. But what I would go back to is the mechanics, which in the shoulder, it's rule of the hand that's real key. I can't stress enough how important this rule of the hand concept is, because it is just really driving proper mechanics in the shoulder. So back off the weights, please, Jason. Barbara Byers says, pure gold, Dr. David. Oh, thank you. Appreciating you big time in knees, shoulder department. Your generosity and sharing your excellent skills is a blessing. From Christchurch, New Zealand. Oh, fantastic. New Zealand's in the house. Glad to be able to help you out, Barbara. I hope that you're applying this stuff and that you're healthier as a result of it. My goal, what lights me up, is to hear stories from you guys, because those of you guys that are dealing with pain, y'all are amazing. Y'all are into cool stuff. Y'all have amazing relationships. Y'all are important people in the world. And I need you to be healthy to continue to do those things. Go help people with your health. Go commit yourself to great causes here in the world. And I am happy. It makes me happy if your knees aren't stopping you from doing that, if your shoulders aren't stopping you from doing that. So go make use of this, please. Thank you for that, Barbara. Orion Z says, good ones. Mindy Gross says, I've been feeling so good this week by following last week's glute strengthening for knee pain. You're priceless, Dr. David. That's awesome, Mindy. Thanks for that feedback. See, that made my day right there. I'm done. I'm good for the week, probably. That's the best ever. I love it, Mindy. Thank you for sharing that. All right, who's next here? We got Vago Betsy, peace and heart signs. Back to work. Sorry to leave. Sorry to take out of your day. Vago. Bango Betsy. Cindy Castillo 3313 says, hi, Dr. David. I now do shoulder shrugs to prevent issues. Yes. It really helped my son when he couldn't reach overhead, and the shrugs was all he needed. Thanks for all your advice. Oh, that's awesome to hear. Those shrugs are a big deal. It's the rule of the hand. It's a version of the rule of the hand with the shrug motion, and then eventually you got to move up into overhead reaches and then weighted. It's just a gradual progression so that you can get to overhead weights with the rule of the hand in place. So I'm so glad that you give me that feedback. That's super helpful, Cindy. Thank you. Brenda Brown says, this one with the pulley is what has been the most benefit to me, has been my gold. Awesome. Yeah, the pulley can get you there for sure. And we have people saying where they're from. Cliff in Arizona. Audi 21 says, do you deal with baseball players as they love doing band work exercises? You showed not to do. Son is currently dealing with a 7mm partial tear of the supraspinatus. Oh, so sorry. Yes, we deal with baseball players, and we're often having to undo all the stuff that they went through. And they get shown the band stuff because they're working with trainers, maybe physical therapists as well. When I say trainers, athletic trainers are usually the people they're working with in the sports world. And they'll do those resistance band rotator cuff exercises. For some reason, those got super popular back in the 70s, and we're still doing them 50 years later. It's 2025, and nobody's questioned what that's doing at the mechanics of the shoulder. I am, and I can tell you, throwing mechanics, baseball, football, any overhead, racket sports, rule of the hand. If you go through a baseball, like throwing a baseball, when you cock back to throw the ball, your shoulder blade should be pinching back. It should be moved backwards. And then as you reach up overhead and let the ball release forward, you're just bringing that shoulder blade through the entire motion as well. Wherever your hand's going, the shoulder blade needs to follow. That's rule of the hand. Proper throwing mechanics should follow that. And I mean, you could practice it with your son, or he can check out this video. I think we've got a throwing video somewhere in our library, and it just improves accuracy. It improves power because you're driving the motion through your big shoulder blade motion, through your big shoulder blade muscles, the trap muscles, the chest muscles, but you're fine tuning it with your wrist and hand and your elbow, so you can get better accuracy that way. Versus if you're not throwing with your shoulder blade, the way that I'm telling you with the rule of the hand, then a lot of the force is coming from the smaller muscles farther away, the rotator cuff muscles. That's probably what led to the tear. He's just putting too much force to that rotator cuff muscles. They're not designed to rotate. They're designed to stabilize. It's really the other big muscles that are going to rotate. So yeah, follow the rule of the hand, please. It makes a big difference. But that's a tough battle to fight when you have a trainer, maybe a physical therapist in the picture, and they're pushing this. But my advice to people in that situation is always put this to the test, what I'm telling you. And if it works for you, go show the trainer, go show the therapist, show them the videos, show them this video if you want. I don't have anything to hide. I'm happy to discuss this with them professionally, passionately, if they want to. And we can go through the mechanics of it. I've done it many, many times. And oftentimes I leave the conversation with them saying, wow, that makes sense. I've been doing it wrong all this time. And now that I think of it, I've been hurting all these people all the time. And I didn't even know that I was. And there's a lot of guilt that they leave with. And I don't mean to make them feel bad, but I'd rather they know how proper mechanics work so that they're helping everybody moving forward. Hope that helps, Audi. Who's next here? I got Ann Garcia saying, I need this, but I'm flying to Spain right now. I hope I can get this entire video later. It is on YouTube. It is on Facebook, and you can get it later for sure. What else we got? Accolade Security, North Carolina, Charlotte, North Carolina. Fantastic. Mackie97 says, hi, I tried the exercises for rotator cuff, and I'm doing much better. Thank you a lot, doctor. You're welcome, Mackie. I hope that you get 100% better. Michael says, hi, brother, from Indonesia. Fantastic. We're in Asia. That is so cool. Carol Whittington says, hi, could my right torn rotator cuff cause shoulder pain and neck pain on the left side? Oh, that's a good one. Neck pain. I haven't even touched that. But I was talking about the deep neck flexors earlier. And that's often the problem is if you don't have good upper trap strength, the shrugging muscles, you usually don't have good deep neck flexor strength. I've seen that happen consistently. So the wall shrug exercise is where it's going to begin to get challenging for you likely here, because if you shrug and your chin wants to just fly out like that, that's something you have to resist. You have to keep your chin down. And if you can go practice that one, Carol, you're going to help your neck out tremendously. In fact, when I have somebody coming in for neck pain, I'll pull the wall shrug out exercise for them. And it's challenging for them, but it does a lot of good. So both are very connected. The neck and the shoulder work together. It's like for those of you that follow me for the hip and knee stuff, the lower back, the abs. I tell people to work out your abs all the time because it sets up glute strength, which then helps your knee. So you have to, in order to help your knee, you have to get better glutes and abs. Doesn't make sense at surface level, but it's the same thing for the shoulder and for the neck. In order to get better in your neck, you have to get better shrug muscles. In order to get better for your shoulder, you also have to get better shrug muscles, assuming you have good deep neck flexor strength, which you're going to work on in that wall shrug exercise. Awesome. All right, we're almost done here. Kodak Bodine says, I haven't been diagnosed by a doctor, but I can't wash my hair or reach behind my back with my right arm. Oof. Do I need a diagnosis to do these exercises, or does it matter? The cool thing with these exercises is if you start here in the black area, these first 1 through 4, and they don't hurt you, you're good. If you gradually progress your way through, then you should feel over weeks that you can begin to do a little bit more at a time. What I highly recommend you do is go check out our rotator cuff tear recovery program, because I go into way more depth. I give you a lot more details in this. There's way more exercises. There's just a lot more in that program. And we'll link it in the description of this video. But I would recommend you go there because then you'll be able to be better guided through the program. You'll be able to know when it's good to stop, when you should back off, or when it's right to just go to the doctor as well. I have such a hard time, saying this on air here, but I have such a hard time telling people to go to the doctor or not, because I know that oftentimes they get told to do things that are not productive. And I'm a guy on the internet. I'm a physical therapist. I'm a licensed physical therapist. I've been doing this for years. I'm an expert in helping people avoid surgery, and we're pretty successful. You see all the comments coming through here. So that's really what you have to go off of. I can't make you do this stuff. I can't make you go to the doctor. You've got to figure out how you're going to proceed. And my recommendation is try it, see if it helps. Maybe you do need in person. I don't know your full situation. You might have some other condition that's making this worse. You might be a straightforward case. I don't know, but you've got to move forward with your own discretion so that you're safe. Hope that helps there, Kodak. Phil says, thank you so much. You're welcome, Phil. Charlie361 says, it takes a while before it gets better with the shoulder problems. Patience is key. Yes. And, yes and no. Yes, in that it's tendons and ligaments, mostly tendons for rotator cuff tear that we're dealing with. And tendons can take weeks to months to heal. But at least it's not a disc problem or a cartilage problem, like knee arthritis or hip arthritis or a herniated disc in the spine. Those take months to heal, minimum. So if you've been dealing with a rotator cuff tear for months or even years, you really just have to put a few weeks, maybe a few months at most into this, and you can undo quite a bit and enjoy the rest of your life. So I wrote long-term here, feeling great in your shoulder and having confidence to pick up heavy things up overhead. A lot of people get told don't lift anything up overhead when they have a rotator cuff tear, and I think that's bad advice. I think doctors are saying that when they see you at your worst, and it's good advice in that moment. But what you don't get is, when do I start lifting stuff overhead? That people just make that their default. They just don't lift anything up overhead the rest of their lives. And then as a result, they're not practicing using their upper traps. They're not practicing using the rule of the hand like I talked about, because naturally we're wired to do that. I have 4 kids and all of them naturally use the rule of hand. I paid attention. They're using their traps properly. I think going through school, being sedentary, maybe having a job, mobile devices, smartphones, tablets, those kinds of things these days are pulling us into less active lives. And as a result of that, that's where we develop these muscle imbalances and weaknesses that come along a little bit easier for us. They come on sooner for us. But if you can get your body to move properly and make sure that you're activating the right muscles by doing the rule of the hand, shoulder forward when your hand goes forward, shoulder up, and you're using all these muscles around your shoulder blade, your chest muscles, your shrugging muscles, the muscles between your shoulder blades, then you're going to go fast. You're going to go as fast as your body can go. So yes, patience, but at the same time, it shouldn't take you that long. If you're dealing with if you don't have arthritis and you just have a rotator cuff tear and that's it, especially if it's a partial tear, you should be done in a month and a half, 6 weeks. If it's a pretty bad tear and there's no arthritis going on in your shoulder, 3 months. If you do have arthritis and it's not really far gone, which you know it when you have it, when it's far gone, those people are like, I can't even move more than about this much. If you can still have some pretty good motion in your shoulder and you have arthritis and a rotator cuff tear, then it's possible for you to get pretty mobile, pretty strong. It might take you a year though, better part of a year, 9 to 12 months, but you can make some massive improvements that will dramatically improve the quality of your life for the rest of your life if you can learn how to use a rule of the hand and do some of these exercises. Which if you're at the end of your rehab, you're feeling good, you should be doing this stuff kind of on a consistent basis. This should be your maintenance plan, the blue, 8, 9, and 10. All right, Emeraldes 12 had the same question as Kodak. Bonine, we have Marilyn, C8133. These are pretty safe exercises that won't make your tear worse. So if you're having any mobility issues, try these. It can't hurt. Yes. For the black part, these and probably 7. So 7, 8, 9, 10. If you have a fresh rotator cuff tear or a very painful rotator cuff tear, I would not do these. You're not ready. You need to do this stuff first for a while, get the pain down, then move into the green, the 5, 6, 7, and then get strong there. You're using the rule of the hand, and then do 8, 9, and 10. It should take you some time to get there, but you're on the right track, Marilyn. All right, Hound Jog says, hi, Doc, why do people get frozen shoulder? Oh, that's a good one. Eventually on both arms, thank you. Frozen shoulder, there's all kinds of confusion about this. I don't have it figured out, by the way. They think that it's a virus in your body that maybe you got when you were sick at one point, that it's still dormant there, or maybe you just recently got it. That it's like the perfect storm. That intersects with you having some injury to your shoulder that now sets off the joint capsule, the joint part of the ball and socket joint, the ligaments that hold it together to just squeeze down and not let you move very much. It's not arthritis, it's different. And what we know about it is that it kind of goes away on its own, but it just takes a long time. It could take up to 1.5 years, sometimes 2 years to go away. On the short end, it might take months, like 3 to 6 months. A lot of people are dealing with it for like a year. What I tell people when they have frozen shoulder is to do like a pulley exercise, exactly like the one that I showed, the assisted pulley. Practice the rule of the hand. And I've seen people thaw out of their frozen shoulder easily doing that because they're practicing good mechanics. They're moving the shoulder the way that it should move. But there's some people that I've had do that and they still don't thaw. It has to run its course. And there are manipulations under anesthesia the doctors will do for this stuff, but I don't know why it happens 100%. I don't know if that's valid, that theory, the virus theory. I've just seen it happen for sure, and it tends to happen in women more than men. It happens in men. I have had a lot of men come in too with frozen shoulder, and it tends to happen at 50 and older. So there's something about the age too. That's the best I can tell you. I don't know. The injuries that I've seen associated with it have always been trivial. I'll tell you that for sure. Once in a while, I see somebody that got frozen shoulder, and I question if it's true frozen shoulder after having another surgery, like it's in response to the recovery of the surgery. But the most classic cases of frozen shoulder that I've seen, I had one guy, it was an older man, 50 something, late 50s. He was squatting down to repair something under his sink, lost his balance and put his arm back to catch himself and kind of just jammed his shoulder a little bit, and that kicked off frozen shoulder, like really bad frozen shoulder. I had another woman that was feeding a parrot that she owned, her pet, and it snapped at her, and she jerked her arm back, and that set off her frozen shoulder. It hurt her shoulder after that. So weird, trivial things like that, where it wasn't like a really bad fall. It wasn't like a car accident. That's what I know, that what I've heard sets off frozen shoulder. But it's got to just run its course. I would do some of this stuff, the pulley assisted arm raises, to help you out. All right, guys, we're gonna take one more here and then wrap up. Michael says, doing a great job. Thank you. Fantastic. Hound Jock says, handstands in the swimming pool help the frozen shoulder at the end range. That's pretty cool. I have not thought of that before. Handstands in the swimming pool. That's talent. I can probably do a handstand in the swimming pool, but I would have trouble just being there very long. All right. Why does hanging help? Do they build stability of the shoulder joint? Yeah, you're putting forces through that shoulder joint that is designed to take so we talked about compressive forces by doing like the weightlifting, the angry cat, the hand and heel rocks. You're adding compression to the joint, but the shoulder joint is designed to both be compressed and be distracted, be pulled on. And so we have to put the forces through it that it's designed to take in order to maintain its structure and ability to do all those things. But we don't hang. I mean, if you think about it, our next closest species in DNA and even appearance is monkeys, chimps, apes. And those guys are swinging from trees and hanging all the time. They call monkey bars for a reason. But as humans in our modern society, with the internet and screens everywhere, we don't do a whole lot of that. I mean, unless you're in a fitness place and it's part of your routine. So we should be able to hang from our hands. It's very possible for humans to do. We just don't practice it. And so we've determined that it's not normal if you're doing this all the time. Because think about it. How many of you guys have seen 60, 70, 80-year-olds that are hanging from a monkey bar every now and then, or hanging from a pull-up bar? It's rare. You usually see youngsters doing that. People in their 20s, maybe into their 30s, and definitely kids on playgrounds. We're designed to do it, but we just don't do it enough. And I strongly believe that you should maintain your ability to do this until your last day on earth. At least hanging. I'm not talking about pull-ups. That's next level. Just hang there for 5 or 10 seconds and don't even do your full body weight. Just do what you can. All right, guys, I'm going to wrap it up with that one. Excellent last question, Ethan. I appreciate it. We will be here next week. We'll be talking about back pain, by the way. We have a back pain program that we're going to be releasing next week, Tuesday, October the 14th, exactly a week from today. So I'm going to be talking about back pain for those of you guys that are interested in that topic. All right, guys. Love you all. Thanks for joining me. See you real soon. Bye-bye.